At different stages throughout life, we all need health services. But today, not everyone has it.
Universal health coverage is the most powerful concept that public health has to offer.
Universal health coverage ensures that all people get the health services they need without suffering financial hardship when paying for it. Some say it's too costly or limits services. But studies consistently show that, when well managed to provide quality care, it delivers better health outcomes at lower costs. Indeed, some global trends could create challenges. More people are living longer, and non-communicable diseases like diabetes, heart disease and cancers are on the rise. Together with increasing costs of new cutting-edge treatments, the price tag for ensuring all people have the health services they need will inevitably rise if not managed wisely. So how do you balance expectations and cost containment while still achieving the best health possible?
The most important step is to let the people understand the real principle of the UC, which is to provide the basic healthcare benefits to every people or to all. Because otherwise, if they do not understand the principle, it will be very dangerous to the program, because there will be a lot of over expectation to the level of the coverage that the government has to provide to them.
In 2012, global support for universal health coverage gathered momentum when the United Nations General Assembly unanimously adopted a resolution emphasizing health as an essential element of sustainable development. Few countries have fully achieved universal health coverage, but every country can work towards it. To get a better understanding of how to do that, let's take a look at some countries already making progress, like China, Mexico, Oman, Rwanda, Thailand, and Turkey. Their experience can provide lessons for countries just beginning the journey. As they move forward, countries should take three things into account: who is covered, which services are covered, and at what level of quality, and how the services are paid for. First, who is covered? With 20% of the world's population, China is a good place to look to see how to cover as many people as possible. In just the past 4 years, 172 million previously uninsured people have been brought into China's health insurance schemes. In rural areas, coverage has increased from 10% to 97%.
09年以来，中国政府，特别是中央政府，投入700多亿元，建设了2400多所县医院和4万多所基层的医疗服务机构，使得广大群众能够在家门口看上病，接受社区的服务医疗。
Wang Baohe is recovering from a fracture in her right hand.
因为我们是属于国家医疗保险，然后这块嘛，我没有担心过，就说看不起病。
In Oman, despite its small population, challenges remain because some of its communities are widely dispersed.
The population is only around 3 million, but the area is over 330,000 square kilometers. More than 95% of our population clusters are less than 500.
200 primary healthcare centres have now been established around the country, one within half an hour of even the most remote village. Often, a large proportion of a health budget goes to hospital care and treatment of chronic and expensive diseases. But in Oman, the health centres help reduce these costs by focusing on prevention and early diagnosis. For other countries, the focus is on expanding the type of services provided and at what level of quality. In Mexico, for example, A comprehensive health package, called the People's Insurance, ensures everyone has access to primary health care, such as vaccinations and skilled health workers during childbirth.
El reto que tiene ahora el sistema de salud es ver que toda la población tenga acceso efectivo y con oportunidad a los servicios y con calidad.
Like many countries, Mexico is seeing the rise of expensive diseases requiring long-term treatment, such as diabetes and cancer. The insurance scheme is expanding to meet these needs.
Posteriormente, la Comisión del Sistema de Protección Social en Salud lo que hace es definir desde el punto de vista financiero si es factible o no cubrir estas enfermedades. Como decía yo, empezamos con una hace 10 años y ahora contamos con más de 60 que están cubiertas, entre ellos, por ejemplo, el cáncer de mama.
Patients like Solozano Alida see the benefit firsthand. She was diagnosed with breast cancer in 2011.
Sin el seguro popular, yo creo que mi vida sería muy estresante por la falta de recursos, porque es una enfermedad que es muy cara en su sanación, en su intervención.
In the past, the high cost meant 1/3 of patients dropped out of treatment or did not even start until very late. Since it began reforming its health system 10 years ago, Turkey has increased coverage to 98% of its people and expanded the range of services available.
Kişisel koruyucu sağlık hizmetleri ve ayaktan ve yatarak tanı, tedavi ve takip hizmetleri dışında organ, doku ve kök hücre nakilleri, doğum öncesi ve doğum sonrası her türlü tıbbi bakım sigorta kapsamına alınmıştır.
Prevention and improved maternal and child programs are showing impact. Maternal mortality has almost halved, and 97% of children are reached with essential vaccines. Thailand also began its journey towards universal coverage 10 years ago. Like in Turkey, it's not just access to primary and emergency care. To meet increasing health needs for expensive treatments, such as kidney dialysis, the government is finding innovative ways to expand services while containing costs. For example, this home-based kidney dialysis device allows 37-year-old Rangthong to continue her work as a seamstress while caring for her 73-year-old diabetic mother at home. This saves trips to the clinic 3 times each week.
แล้วไหนจะค่าเดินทางเราก็ไม่ต้องเดินทางเราสามารถทำที่บ้านได้น้ำยาเขาก็มาส่งให้ถึงที่บ้านโดยที่ว่าเราไม่ต้องไปรับไปอะไรเขามาส่งให้ถึงที่มีทุกอย่างพวกเกี่ยวกับการทำแผลอะไรพวกนี้เขาก็ให้หมดเลย
Perhaps the biggest challenge on the journey to universal health coverage is how to cover the cost. A unique aspect of Rwanda's health system is that 55% of the budget is managed at the community level, and progress is measured against specific health targets.
You clearly set how that is going to be measured, and then measure it and have people accountable. Not just accountable to their seniors, but also accountable to the population.
The government covers the insurance premiums for the poorest 25% of the population. In the last decade, coverage has increased from 7% to 97%. People are living 10 years longer. Child mortality has been cut by half. And deaths from malaria have dropped by 2/3. As you can see from these examples, each country's road to universal coverage varies depending on its own health needs.
There is no one-size-fits-all model. Countries must take into account their historical development, their health system capacities, and also their ability in terms of the speed and the scope of coverage to move over time.
But the essential ingredient in all these examples is providing basic primary care to everyone. to prevent diseases from ever starting, or diagnosing them early when they're much more treatable. This is a step every country can take, and providing health services and care for everyone creates a healthier community for all of us. This is key to making healthcare affordable and helping as many people as possible live longer and healthier lives.